Hello, I'm Dr. Jessica here to wish you all a very happy Holi and also to convey an important health message. This year's Holi celebrations will be starting this Sunday with the bonfires of Holika Dahan, and my message to you is please do not burn dung and do not breathe in such smoke because this can harm your health in many ways and could even cause the most dreaded disease of black fungus or mucormycosis in the coming months. Please, without prejudice, listen carefully to what I'm saying. This is for the sake of your own health. Hope you still remember the black fungus epidemic India had in the summer of 2021, at the height of our COVID second wave, when our health ministry officially recorded more than 50,000 cases in 6 months. At that time, no other country suffered this scale of a fungal epidemic, even though COVID was ravaging the whole world. So I have been researching this disease closely since then to learn more about it and why India is especially prone to it. And here are some known facts that I would like to share with you. This black fungus or mucormycosis causing fungi called Mucorales are present everywhere in the world. It's a soil fungus and is known to thrive in rotting vegetation and animal dung. The dung of grass-eating animals like cows, buffaloes, goats, camels, donkeys, etc. are especially rich in these fungi. The spores of these fungi are released into the air. So when humans breathe in the spores from the air, they are at a risk of getting the disease. The two main factors that increase the risk of you getting the disease are, first, the fungal spore load you breathe in. That is, if you breathe in more spores, your risk of getting the disease is higher. And the second factor is your own health. That is, if you're diabetic, then you have a much higher chance of getting the disease. Similarly, if you're immunocompromised, meaning you're sick with any other disease, or taking immunity reducing medicines like steroids or are getting treated for cancer, your risk of getting the disease is much higher. So these facts are applicable to everyone around the world, and yet at the same time makes our India the ideal place to contract this dreadful disease. How? As you know, with 1.4 billion people, we have a huge number of diabetic and immunocompromised patients in our community. And being an agricultural economy, we have a huge number of farmers and other workers coming in regular contact with soil, manure, and vegetation, the rich sources of these fungi. And with over 300 million cattle, we also have the largest dairy animal population, which means we have a huge load of animal dung in our country, with most of it lying out in the open. This naturally increases India's environmental load of fungal spores much more than in most other countries. So these high numbers of vulnerable Indians breathing in higher doses of environmental fungal spores at all times itself increases the risk of Indians to black fungus. Now add to these crucial factors our many unique cultural practices that increase these risks much more. The main ones being the burning of dung and stubble. So from what we know from an emerging field of science called pyroaerobiology, microorganisms, including fungi, are tough enough to survive the high temperatures of open fires, and they can get dispersed through the smoke of these fires at a much higher concentration than in normal air. So when we burn dung or stubble, these fungi, already present abundantly in the dung and stubble, will rise up in the smoke and spread far and wide. These fungal spores can then enter the nose and respiratory system of anyone breathing such smoke. And such heavy loads of fungi can cause the disease even in healthy Indians, and more so in diabetic or immunocompromised Indians. Following this reasoning, after every major dung burning or stubble burning event, we can expect to see a spike in cases of black fungus. And from my observations for the past 2 years, this has held true. My research has indeed shown that over and above our high baseline, India usually gets 3 noticeable spikes every year, all of them around 3 to 12 weeks following mass burning of dung or stubble. These spikes are first in February following the major festival season in January, then second in April to June after Holika Dahan, and the third in November-December after stubble burning and Diwali. And confirming these predictions, The two most recent reported spikes were from Bathinda in November 2023 and Beckener in February 2024. And I can say with full confidence that there will be a spike of cases in the coming April, May, June time this year as well, in all the places where dung is burnt for Holi Dahan and in areas downwind to them. This alert is especially relevant to states where Vedic Holika Dahan with cow dung is actively promoted. We have already published a peer-reviewed paper on this risk in 2022, and these facts have been known to our health authorities since the epidemic of 2021, when I first alerted them to the possibilities. But it's unfortunate that they and most Indian doctors hesitate to do more local research on this or warn our people about the terrible risk they are facing whenever they burn dung or stubble. It seems they would rather protect Indian culture than innocent Indians. I face a lot of backlash for spreading this message, but I will continue to do so because science backs my observations. And so educating the people of the risk is important, even while we wait for conclusive studies, because every year we lose too many Indians to the dreaded black fungus, and that is not acceptable. So in the meantime, take care of yourself. Do not burn dung or stubble, and do not breathe in such smoke, especially if you are diabetic or immunocompromised. At least wear a mask when there is smoke in the air. Stay safe. I'll add a Hindi transcript of this message and relevant links to articles in the section below. Thank you for listening. Happy Holi once again.